Younger generations today, they're not worried about their skin color, but their parents are.
Let's say someone comes in and says, I want to look 3 shades fairer.
Yeah.
I want glutathione 3 times a week. Would you actually discourage them?
Absolutely, I do. Because what I tell them is that, listen, it's not about looking fairer or lighter, it's just about looking glowing. Then they gave it to patients who are on chemotherapy to help them to take away the side effects of chemotherapy. So it really came from a good place. It's just that they noticed when they gave it to these patients, some of them looked lighter, brighter, fairer, etc. Skin actually is the first area where you'll actually see signs that something's happening wrong on the inside. There are times where I've diagnosed possible cancer in my patients even before their cancer test picked it up, just because of the way their skin and hair changes were happening. But at 44, women have an accelerated aging where collagen actually incrementally reduces. And the next one is at 60. 95% of the damage that happens to our skin is because of ultraviolet radiation today. Yeah, if you're over 21, there's no business for acne to be on your skin. Glass skin is really a filter. It's not a skin type. And the whole idea behind that is just to have a skin that's healthy, glowing, and even tone. Everybody wants to take magnesium, everybody wants to take a melatonin, and I'm like, why? Your body naturally makes it. You take it if you're deficient. Supplements are not candies, and that's the other thing, Anushka. People are just popping supplements like they're candies or gummy bears. Yeah, it's about just being the best version of yourself. That's it.
The safety of anti-aging cosmetic treatments and injectables often comes up as a topic of debate in our society. Should we rely on shortcuts to look glamorous, or is it more sensible to take a holistic approach to skincare and overall beauty? Striking the right balance is extremely important, and having a reputed, qualified doctor to show the way is advisable. Very pleased to have with us on Buzz by the Bay, renowned aesthetic dermatologist, Dr. Chytra Anand.
Thank you for having me, Anushka.
Welcome on Buzz by the Bay. You just come from Bangalore.
Yes, I just landed into your city.
Okay, so wow. So, but you have a practice here and in Bangalore and all over the country.
Yeah, Delhi, Bangalore, Mumbai, Chennai.
Okay, wow, fantastic. Very dynamic. I of course follow a lot of your suggestions on social media and all, some very interesting suggestions you have. And what's nice is you talk about related factors, nutrition also, and you also talk about weight loss drugs and things which I want to touch upon in the course of the interview.
Sure, because I truly believe that it's inner health and outer glow. You can't have one without the other.
Absolutely, which is what I said, you have to strike a balance. Yes. Sure, you can't demonize all procedures, but doing too much also, I guess, comes with its side effects.
Of course it does. Too much of a good thing is never a good thing.
Yes. So, Dr. Chytra, it's back in focus. Sadly, with the demise of a very young actor. And then people started getting into this debate. Was it because of IV glutathione? Now, glutathione is what a lot of people take to, I think, detoxify. You'll be able to explain better. Maybe even brighten the skin. Some say even become fairer. Or was it just too many anti-aging injectables? People are speculating that could have caused this, the cardiac arrest. Firstly, what is safe, what is not? What's your take on glutathione IV drips?
So let's break it down, Anushka.
Yeah.
So glutathione, it's nothing but an antioxidant, right? We actually talk about it as being a super antioxidant because it has the potential to defend the body against what's called free radicals. Now, across everywhere, right? In the food that we have, in the water that we intake, there's pollution in the air. All of this releases something called free radicals which go and bite into our cells. It could be skin cells, heart cells, lung cells, etc. and they cause a lot of damage. One of the ways to protect from that is to have something called an antioxidant that we use. Like Indians, we use turmeric in our diet, right? Curcumin, that's a potent antioxidant. Similarly, so is glutathione. But glutathione in a way is considered super because it does a lot of things. And of course, we naturally produce it in our body and it is one of our defense mechanisms. But like everything else, nobody is in optimal health state. So when that happens, obviously the depletion or the reduction of the glutathione storage happens in our body, especially post the age of 25, because that's when aging actually sets in. So that's when you have to put it in. You can have it as a oral, but the thing is absorption is not as great. So intravenous is one of the ways to do it. And it actually all started because they started giving glutathione to patients who had severe alcoholic problems. Because when their liver is in a state of decay, then what happens is they needed the glutathione to detoxify the body and help regenerate the new cells, because it's antioxidant. Then they gave it to patients who are on chemotherapy to help them to take away the side effects of chemotherapy. So it really came from a good place. It's just that they noticed when they gave it to these patients, some of them looked lighter, brighter, fairer, etc. And a lot of these are Caucasian patients and Oriental patients. It wasn't really Indian patients, right? So we have to talk about that also. Then it caught this whole big bug as a lightening drug, and it became very popular as a lightening and a fairness agent. And that is really actually where we have to stop this. It's not a lightening agent in that term. Glutathione works on our body, and what it does is it changes the brown pigment into a red pigment, because it's glutathione is nothing but a bunch of amino acids to just break it. So it gives one instead of the other, and instead of brown you get a lighter shade of a brown pigment or a red pigment. When that happens, there's a slight brightness to the skin. Now for that to happen, you have to have excess of glutathione, and excess of anything is never good. And your body is going to detox it, right? Your liver will detox the gluta and you'll pee it out or poop it out, literally you pee it out. When that happens, the effect goes away. It's very transient. For that, you're putting the body through a lot of excess glutathione just to look like fair. And people do chase that pipe dream. It's not that people don't, but that's where I always say, speak to a reputed doctor. And I have patients who tell me in my gym now they're giving me glutathione drips.
Oh my God.
Yeah.
That is not safe, right? And this is why we hear of accidents.
That's why. See, first and foremost, it's an intravenous, right? IV. Anything that goes into your bloodstream is directly in your bloodstream. So you've got to be careful about who's giving the IV. It has to be a doctor or a nurse. It can't be a gym trainer, or it can't be a beauty therapist in a salon giving you an IV.
It's now quite an open secret that they take glutathione to make themselves look fairer, because from what I understand, glutathione also reduces the melanin in your body.
Changes the melanin.
Changes the melanin in your body. So I've had actually doctors tell me, dermatologists tell me that glutathione has an impact on eyesight. It can worsen your eyesight, too much of it, because it changes the melanin. And now that's also the pigmentation in your eyes, right? That gives you the eye color.
So what it can do is it can give you early cataract actually. The reason is the melanin in our eye protects us. It's like a filter, right? Like a sunscreen against the sun damage. So lighter eyes get cataract faster than darker eyes. So it can lead to early cataract if you start lightening yourself a lot. But there are people who do it like once a week basis, because if you just do it once a month, that's for health factor. And there's enough studies and data that show that actually people who have increased levels of internal cellular breakdown, if they have glutathione once a month, it actually is cardioprotective.
Do you discourage people from doing that? When, let's say, someone comes in and says, I want to look 3 shades fairer. I want glutathione 3 times a week. Would you actually discourage them?
Absolutely, I do. Because what I tell them is that, listen, it's not about looking fairer or lighter. It's just about looking glowing.
And we are Indians. We are brown skin. We have South Asians. Well, what does it need to look like Caucasians, you know?
I think it's a societal problem. It's been there for a long time, but we see that changing. Like younger generations today, they're not worried about their skin color, but their parents are. So I see that when kids walk into my clinic and stuff, we never actually discuss skin color anymore. We discuss actually skin quality, glowing skin, and of course, Korean glass skin.
Everybody wants this Korean, like vampire facials and glass skin. That is, we'll come to that. That's such a trend, you know. I mean, Korea has become like the last word in skincare these days.
It is.
So it is, to a large extent, this is an industry that's also built on insecurities. But Of course, everyone has a right to look beautiful and everyone has a right to look the best they can. But it's interesting, I'm glad that you say that young people come in and they're not really bothered about their skin color. It's the older generation, really.
Yes.
I've heard this too. I've heard doctors tell me that people come in with their children and say, oh, mere bacche itne kaale hai, like they're so dark, can you do something?
Yeah, we see
That's
that.
horrible.
And then the kids are like, what is this? And we're like, what are you saying? They're like, nee, we have to get her married. Please, can you make her like in 6 months lighter? And I'm like, no, then don't get married. And I look at the kid and I'm like, if the guy you're marrying is marrying you because you're lighter, do not get married.
So coming to, okay, we've discussed glutathione and thank you for clarifying things. What about treatments, anti-aging treatments that are safe? Now, I've heard that there's a bit of like filler fatigue going on. Is that true, or fillers? How safe are fillers? How much should one do? And, we'll come to other treatments.
Like when we say anti-aging, I want to clear that term itself. I think it's not about anti-aging, it's more about maintenance. We should look at it as maintaining ourselves. Think about it. A person gets a gray hair. Are they going to let it be? No, they go and dye it or they go and put a henna, right? And it's like, oh my gosh. So why is it okay that you have blotchy skin or you have scars or you have lines and wrinkles? And what's wrong if somebody wants to take care of it? I always tell my patients this. So it's not about anti-aging, it's maintenance, because honestly, everybody lives longer these days. Skin actually is the first area where you'll actually see signs that something's happening wrong on the inside. There are times where I've diagnosed possible cancer in my patients even before their cancer test picked it up, just because of the way their skin and hair changes were happening. And I'm like, no, something's off. And there are times where I pick up polycystic ovaries and then the blood test doesn't show it, the scan just picks up a hint of it, and I'm like, no, I see the signs, but within the next few months you're gonna show the signs. Hypothyroidism, we pick it up faster than the endocrine picks up, because the signs of it, the changes that happen in the skin and hair, show up way before it actually clinically happens in your test.
Yeah, nothing wrong with fixing it. We shouldn't judge people. It's just when people go overboard.
Yeah. Oh gosh.
And they're driven only by insecurity and it becomes an obsession. And when you're a public figure, you're setting a bad example for people.
It's very sad. A lot of my patients ask me that, doc, why is this person looking so bad, right? They can have the best in the world. So there's two things to that, right? One is on the patient and one is on the doctor. The doctor also has to know where to say no. You can't lift everything by just filling. People think you put a filler, you'll fill and you'll lift. That's where people go wrong. You can't. It depends on what was the cause for that sag in the first place, right? If the sag was because you lost volume and your face is gaunt and hollow, the filler fixes it. But if it's because you're bulky and your tissue is starting to hang because your collagen or your elastin has worn out, then you need to fix that. So it's also wrong therapy sometimes.
So let's come to some of these treatments. Like I said, like HIFU, you mentioned, this high intensity ultrasound, and fillers. Which are the safe treatments that you would advise to women in their 40s, for anti-aging, for building up collagen? Because we lose collagen.
Of course, a lot of it.
That means we lose that suppleness in our skin.
Yes. So, it's a great question. And I think it's each to their own, honestly. And every decade brings a change to it. Because we're Indians, we have great bone structure for most times in this part of the face, where we have poor structures really here. Yeah. Okay. Everybody tends to have like a weaker chin in India, which is why we tend to sag a lot faster here.
Yes.
We don't get those crinkles. We don't get these as much as Western population. There are two things that we get. We get this, like sunken eyes, dark circles because of the bone structure here. And then we also get the droopy lip here with this stunting. So that's what happens to Indian faces. Filler works best for fixing that because they are structural changes. But let's say that your tissue is starting to sag. There are two things that keep our skin tight, right? Collagen and elastin. Collagen is what helps your skin stay supple and firm, but elastin is the recoil, so that when you stretch your skin, it bounces back. That's the recoil, right? You need both. We always talk about collagen, but people forget that elastin is also just as critical. Now, for every year, we lose about a percentage of our collagen and stuff like that. But at 44, women have an accelerated aging where collagen actually incrementally reduces. And the next one is at 60. One of the reasons is perimenopause, which starts by the age of 35. People think it's only in my 40s, but really perimenopause starts at least 10 years before you go towards menopause. So typically 35, right? It's like we don't even have a break, right? You have periods, you have pregnancy, breastfeeding, and then you're like into perimenopause.
Perimenopause.
When does it ever stop? Menopause. So, that's what happens. So I always tell patients, 35, if you've not done anything, just do a good basic skincare, but at least at 35, start collagen banking. What I mean by that is start like non-invasive procedures like Altera or HIFU or even a basic microneedling where you're having it so that your collagen stimulation is going on. So that way you don't lose the collagen, you're actually building more collagen. So when you get to your 40s, your skin is still firm and healthy. And then when you start seeing that your jawline is losing its definition, because youth actually lies in smooth contours, even skin, and a sharp jawline. So if you do this, you can just maintain for a long period of time, right? And it's not expensive, these devices. They're actually very reasonable, less than facials if you break it down sometimes and stuff. Then when do you inject Botox in fillers? Let's say somebody is very emotive and hyper dynamic in their expressions. They start forming lines which are like stationary lines. Typically people who tend to frown here, I have Botox, so I can't frown that much, but mine is very natural Botox. But so if you have this right here, you don't want this. This is a negative expression. So you want to knock that off. Or if you're having these preset lines, that makes you look aged. So those are the lines you want to subtly stop. So Botox can actually reverse your set lines. So if you do subtle Botox, not the freezing kind.
Subtle being the key word.
Yeah, like mine. See, I can frown, I can raise, I can sprinkle.
You can move your face.
I can move everything. But the thing is, it has to be subtle. Because when you do that, then you're just softening the lines, not freezing it. But these are all the procedures, right? Procedures are good, but it's not going to fix you if you don't use the right skincare and if you're not healthy with your diet and exercise routine.
Okay, right skincare means like sunscreen, collagen creams.
Not collagen creams. See, very basic routine. All you need is to cleanse your skin. So you use water and use a soap-free cleanser. Something that's pH balanced, not soap on your face, because soap dehydrates your skin. Your skin is naturally acidic, and the acidity of your skin maintains the skin barrier, okay? If you use soap, which is an alkali, you're stripping the acidity, so the skin starts dehydrating. So you don't want soap, you want to use like a pH balanced cleanser or a soap-free cleanser. Then if you have a skin concern like pigmentation or acne or dry dehydrated, then you use a treatment product to fix that problem. Then you use something to nourish, which is like your moisturizer, but with like ceramides, hyaluronic acid, sodium hyaluronate built in. You need the ceramides, and if you're very dry, you need something called squalene also. The reason is that's what your skin barrier is. It's not vitamin E, it's not aloe vera, it's not the cocoa butter, shea butter. It's actually ceramides and squalene. So put that back because you're losing that, right? Then you need something to protect your skin. Protection against UV radiation or sun, as we call it. Out of all of this, if my patient says, I'm not going to do anything, I'm just going to do one thing, I'm like, just wash with water and use your sunscreen. The reason, why? Because 95% of the damage that happens to our skin is because of ultraviolet radiation today. For everybody, especially Indians. Why? Because when the ultraviolet radiation hits our skin, right, it causes a chemical reaction. When it causes that, it traumatizes the skin, which means the skin gets inflamed, and that free radicals I was talking about, it causes free radical damage. Over a period of time, when you have constant inflammation or damage to Indian skin, it leads to hyperpigmentation, which is why 90% of Indian women will suffer from hyperpigmentation, and over 15% of men suffer from hyperpigmentation in their lifetime. If they used a sunscreen religiously, a good sunscreen, not every sunscreen is a good sunscreen, make sure it's tested to be the right sunscreen, and then if you use it regularly, you will prevent that.
Do you want to recommend a couple of sunscreens for people?
Sure, happy to. Like, I love Skin Q sunscreen because it has a built-in
which one?
Skin Q.
Skin Q.
Yeah, Skin Q because it has a built-in vitamin C in it. So you already have an antioxidant while it's protecting you. The other one I like is La Shield. La Shield is very easily available. That's a good sunscreen to use in the market because it's non-sticky and stuff like that. Then there are people like CeraVe who make a sunscreen now. They have a fluid sunscreen. Another favorite of mine is Neutrogena.
Yeah.
It's really phenomenal. They've done a lot of work. And then there's another one from La Roche-Posay, which is a very, very good sunscreen because it has a new molecule called Miroxil. So these are really good sunscreens. And I would say use pharma grade sunscreen, not necessarily just a branded sunscreen, because you want to have data that it's been tested. And sunscreen is not just about SPF. Everybody talks SPF. It has to be SPF and PA. So SPF is against the UVB light. PA is against the UVA light. So you need the broad spectrum on that.
So SPF for 50 at least?
30 to 40 is enough.
30 to 40. And PA?
3 to 4.
3 to 4.
Yeah, at least 3 plus.
All right, very useful suggestions. I have a few follow-up questions before we go on to the next topic. One is you mentioned collagen banking through microneedling and HIFU.
And Altera.
So
yes.
what is the cost of these therapies?
So a microneedling, you can get a microneedling for something like 10 to 15,000 rupees a session. A HIFU would be around maybe 25,000 per session, and you only need 2 of them in a whole year, and then you get into a maintenance once a year. So it really breaks up. If you actually break it up, it's 2,000 rupees a month if you think like that. Therapy on the other hand is like the Rolls Royce of all the treatments. So it is more expensive because the device itself is amazing.
Which therapy? Sorry, can you?
Altherapy.
Altherapy.
Yeah, Altherapy. So that is a little bit more expensive. I think the starting price on that would be about 75 to 80,000 a session. But even then, if you do break it down, it's about 7,000 rupees a month if you look at it like that. But it's just that you need only one session. It's not like you need to redo it. And then after a year, you redo it, and then slowly as your skin gets into that cycle of building its own collagen and not depleting collagen, you can do it every 18 months. So it really works out well. So these are the things that one should actually think of doing as a maintenance, right? Like you cut your hair every 3 months.
I've heard from people who practice face yoga that they've had people who've done HIFU a number of times and that has led to face paralysis. Can that happen?
No, it doesn't happen, face paralysis. But what can happen is if the heat of the setting was very high for that person, temporarily it can cause a numbing sensation in their face for about 1 to 2 weeks. It's extremely rare.
Let's come to hyperpigmentation, which you say is a problem with a lot of Indians. What is the therapy, what is the treatment you suggest for hyperpigmentation?
First thing, if you're in your teenagers, in your 20s and you're not using sunscreen, get started on that sunscreen. It'll prevent it.
Okay.
And in pigmentation, prevention is better than cure. Honestly, till date, we don't have a 100% cure for hyperpigmentation.
Okay.
We can reduce it. If it's sun damage, yes, we can get it out by 95%, sometimes 100%. But if it's melasma, which is what typically most Indians get, or there are other types of pigmentation, but melasma is one of the commonest, there is no 100% cure. And if somebody promises you a 100% cure, they're lying because there is no cure. We can reduce it and we can control the melasma, because the melasma will go up and down. There'll be times when it'll flare up, then your doctor will intervene, it'll come down, and we can reduce it by about 70 to 80%.
How?
It requires few things. One is a dedicated skincare program with prescription medicines and non-prescriptives. If it's non-prescriptive, it's your barrier creams and sunscreen and pigment reduction creams. And then it needs prescriptive pigmentation reduction creams, right? Like high-strength retinol, high-strength, not retinol, high-strength retinoic acid or tretinoin, and high-strength hydroquinone, etc., which is a prescription-based cream. And non-prescription, you get a lot in the market, right? Kojic acid, licorice and stuff. So they help, but they're not going to cure it. They'll help reduce a part of it. That's one aspect. Second, on the nutritional aspect, because a lot of times, and also the hormone type, because a lot of times people tend to be hypothyroid, or they tend to have cortisol issues, or they tend to have history of polycystic ovaries when they've developed melasma in their life, or they're in the perimenopause, menopause stage. So we look into that and look at correcting those hormones. And then the third is the procedural aspects. Initially, we actually start off with very basic procedure, like a very light, superficial peel, where the skin doesn't peel, but it's just gentle exfoliation, and then you condition the skin, because you can do a lot of procedures, but if the skin is not conditioned, it gets more reactive and you get more pigmentation, which is called post-inflammatory hyperpigmentation. And Indians have an incidence of 65% of PIH if their skin is not prepared before the treatments.
Really?
Yeah.
Oh my God.
Yeah.
Earlier you mentioned something about how, and you're right, how, ailments manifest on the skin and hair.
Yeah.
Right? A lot of autoimmune ailments manifest on your skin.
Yes.
We know that. And you said even cancer, you've identified it sometimes before even the test. Like how do you identify it? What are the signs on the skin and
Look,
hair?
a healthy skin, right, is just normal, right? And it's smooth, glowing. You wake up in the morning, you wash with water, your skin should just feel fine. If it starts feeling tighter after you wash, there itself is a sign that something's wrong. That's your first sign. That means you're dehydrated. What is the causes of dehydration? Like, we're sitting in an AC room and that's always going to pull the water out of our skin. So you need to have a barrier cream so you don't get dehydrated. One is on the internal, but hypothyroidism. Let's talk about that. People who are hypothyroid tend to get more drier. So they get dry skin, dehydrated skin, they get frizzy hair, and they get brittle nails. It's because your thyroid is not functioning. What people don't realize is for your thyroid to function, vitamin D is critical. And we know that Indians genetically are prone to vitamin D deficiency. So most people are vitamin D deficient. And then when they think they're in the normal level, normal is not good enough. You need to be on the optimized level. Like functional medicine doctors will tell you that if your normal for your vitamin D is 30 and above, you actually have to be at a level of 70 for your vitamin D. At 70, optimizes your health, which is when it gives enough vitamin D for your thyroid and everything else. Similarly with cancer, right? If someone's having cancer, which you asked me about, typically what happens, we do see that they're starting to form pigmentation, and you start seeing that their skin is getting very frail and very sensitive and very like raw, and it starts thinning out.
Thinning.
Yes.
And you see
very
the veins
fast.
and things like that?
You can start seeing blood. And you see this because what's happening is, because of the cancer, their appetite will shrink. And when their appetite shrinks, they're not getting enough nutrition. The gut health goes for a toss. They're not getting enough nutrients. And when you don't get enough nutrients, you don't get it to your skin. Because skin, hair, etc. are considered end organs.
So you spoke a lot about hormones, and I see that you talk a lot about it on your social media also, depletion or excess of which hormones cause which problems, like acne and stuff like that. It's basically hormone related.
Yeah, if you're over 21, there's no business for acne to be on your skin. Maybe that one around your period time if you're a girl, but you shouldn't be getting acne if you're over 21, because most of your hormone changes, of your maturation time is over by then. And especially if you're over 25 and you have acne, it's 100% what we call as adult acne. And adult acne, majority of the times, is because of hormone imbalance, like polycystic ovaries in girls. It could also be because of rarely prolactin increase. It could also be like cortisol changes for guys and girls, and changes in testosterone levels for the men, etc. And hypothyroidism also has a role to play in that. And there's something called hypothyrotoxicosis, which is like an autoimmune thyroid disease that also has a role to play. So it's mainly hormonal, or it can be, in some patients, lactose intolerant if they're using a lot of lactose, or if they're doing whey protein and they're lactose sensitive, right? Or extremely high sugar diet and stuff like that.
So how do you treat it? Through diet? Do you give some supplements?
Yeah, so if there is, first we'll do a blood test panel, and then if necessary we'll do ultrasound of the abdomen and pelvis to rule out ovaries and cysts, etc. If some people will even ask for an MRI of the brain if the prolactin is off, right? That's the investigative side. But for treatment side, it has to do with a diet plan, because they have to fix their diet also. Then it's oral medications, prescriptive medications to correct, because you've got the cause, you've got to fix it, the cure, and that is prescription medicines. It's usually along with a GP and an endocrinologist involved, and sometimes maybe even a gynecologist involved if required. So it's a multidisciplinary force that takes cognizance of this fact. But that's all fixable. So the good thing is it is fixable. In 3 to 6 months, it can be solved.
So what do you advise them to eat? Like a woman, of course, that will depend on what hormone is less, whether it's the testosterone, the estrogen, progesterone, androgen, whatever, cortisol. But Generally, what would you advise? Let's say a woman who comes who's 25 has some PCOS, and then what would you advise her?
So what we do is for PCOS, what we always say is that exercise is critical. So we always ask them to exercise. It's not necessary that they have to join a gym, but what they need to do is get those 10,000 steps a day, the movement going. And I actually tell them to do something like an interval training, which is more like a fat burning exercise. And if they have nothing, I tell them if you live in a building which has at least 2 stories of 2 stairs, at least go up and down like 10 times, like 20 stairs, flights of stairs. On a daily basis. That's more than enough to put your body into a little bit of stress, which then burns your calories, because fat also, people don't realize, stimulates testosterone production. And so there's that also. There's a indirect feedback loop, as we call it.
Now, I want to come to a bit of hair care before we go into trends. What should you take? What vitamins should you take? I know nutrition hair has a lot to do with nutrition, of course.
Yes.
The same nutrition for the skin works for the hair, I'm
but
sure.
Hair needs a lot more, because hair is just dead. Like, all of this is just dead. The only living component in your hair is your scalp. All of this is dead, right? So it's like, and like I said, it's an end organ. But hair supplements is not just the vitamins. It's vitamins, it's minerals, it's amino acids, and there's something like trace elements, right? Like zinc, etc. So you need copper peptides, all of that. So you need all of this amalgamation for your hair. So whenever I tell patients, if you do this and you get hair falling off, that's nutritional. But you start seeing that, you know, you're tying your hair into a braid or into a pony and it looks less chunky, and you're starting to see scalp, that's hormonal. But if you do this and it falls, that's nutritional, and that can be fixed by taking supplements. But it's just taking a biotin or a folic acid or just an iron is not sufficient. You have to do a nutritional program. There are therapies called hair cyclical therapies, which actually have different tablets of one with iron, one with protein or amino acids, one with trace elements, one with multivites, and you take that.
Lastly, Dr. Chytra, we've had a very, very fascinating discussion, and you've given us some fantastic tips, really. But lastly, I want to talk about what are the beauty trends that are in vogue or hot in 2025. We can end with that.
I think you can see that we're moving more towards longevity and regenerative medicine now. It's all about how do we stay healthy for long and how do we regenerate ourselves. I see the movement going towards that in the plus 35. In the youngsters, it's still that their craze right now is really about filter skin, right? The Korean glass skin and stuff. So I think we're on 2 ends of the pendulum right here. On one end, it's just whatever's on the surface has to just look super smooth, super clean, super glowy. And on the other side, it's like, what can I do to fix on the insides and stuff? So on the glass skin side, like I tell everybody, glass skin is really a filter. It's not a skin type. And the whole idea behind that is just to have a skin that's healthy, glowing, and even tone. That's what a glass skin really is. And you know, I've lectured extensively in Korea on cosmetic dermatology, and one of the things, I was there last year in July, and I was doing a workshop on threads and stuff, and I remember meeting women in the clinic, and they all have something called a beauty leave. So once a month, the Korean women actually have 4 hours time off at work where they can actually go to their dermatologist or their aesthetic doctor and get their skin fixed, and that's an accepted time off from work. This is how much they take care of their skin. That's why they talk about Korean glass skin. Indians, we don't do that. I mean, even to put skincare, they're like lazy. Then procedure, maybe once in a while. So it requires dedication and discipline. That's on that end. But saying that, yes, you can have procedures done to get there, right? Like there's a glass skin, which are just, you don't have to do a lot, but just like getting hydration, getting the polypeptides and nutrients into your skin, that's all you need to get side.
You get that glass skin effect.
Exactly. On the other side of the spectrum, where we're talking regenerative and longevity, etc. So nobody is really talking Botox fillers. It's like passe. It's more on this. We talk about like exosomes and stem cells, etc. Stem cells still, there's a lot of data that's required, so we don't touch upon them. But exosomes are here to stay.
Yes.
And exosomes are everywhere, for skin, for hair. And there are IV exosomes, but not in India, but in Switzerland, there are IV exosomes that are happening. It's happening in Dubai also for longevity. It's happening in Mexico also, and your whole plasma change and all of that. So I do see that a lot of this is going to go towards that. These are the good trends. The bad trend, though, I have to talk about it, is this pill popping habit that everybody has. Everybody wants to take magnesium. Everybody wants to take a melatonin. And I'm like, why? Your body naturally makes it. You take it if you're deficient. You do not take it if you don't need it. Just because it's across the board and it's available, everybody's popping. And everybody's taking a vitamin B supplement lifelong. I'm like, no, you do not take a multivitamin lifelong. You take it when there's insufficiency. And at least till 35, 40, you should be able to get it corrected and maintain it with your diet. After 40 years, it's a depleting way. Then you may need long-term supplementation, but otherwise you shouldn't, because the moment you start over supplementing, your body is going to get lazy. It's going to say, hey, you're over supplementing. I don't need to work that hard, so I'll take it easy. So it's not a great thing. So, and supplements are not candies. And that's the other thing, Anushka. People are just popping supplements like they're candies or gummy bears. Gummy bear supplements are also supplements.
Yeah.
Just because it's a gummy bear doesn't mean anything.
Exactly.
So you have to be careful about what you're taking, how much you're taking, so that you don't overdo it.
Right.
That also has adverse events.
Okay, thank you. Those are very good tips. Don't overdo it. Don't over supplement.
Yeah.
And of course, look at longevity and regenerative, skin and hair health. Okay,
Yeah, it's
thank
about just being the best version of yourself. That's it.
Absolutely. Thank you. Thank you so much, Dr. Chytra, for
Thank
being
you
on
so
Buzz by
much.
the Bay. Thank you.